Hello, welcome to the latest Feel Good Suffolk webinar. My name is Chris Pyburn. I work for Public Health and Communities. As with previous webinars, you're going to be hearing a number of updates from different presenters around different aspects of the service. We really hope you find these webinars helpful. They'll be continuing on a monthly basis as we go through the year. If you'd like to share any feedback on the webinars, we'd love to hear from you, both in terms of content and format. And also, if you'd like to share any questions that you'd like us to pick up and answer, then there'll be more information at the end of the webinar about how you can do that and the deadline for sharing your questions as well. So I'd like to hand over to Gemma Levi first as the first presenter of the day. And again, please do share your feedback. We'd really like to hear from you. Many thanks.
Welcome everyone to the third instalment of these Feel Good Suffolk webinars. I hope you're finding them of use, and as Chris says, please do send us any questions or any feedback on what you'd like to see in these webinars going forward. I would firstly just like to say that we're really pleased to be seeing some of the successes coming through from the service now. We know that the referrals coming through for our exercise on referral, our walks, our adult weight management and our smoking services. I know the team have been receiving some really great feedback, particularly around smoking and adult weight, where we've seen people accessing the abstinence-based programme, which has been delivered by Alan Carr. People have been reporting that on going through to Alan Carr, they felt really nervous, anxious, worried about what that was going to entail. Was this really going to work? Were they really going to walk into this day's seminar and then finally not be able to smoke? It almost seemed too good to be true. But we've had wonderful reports to say that people experienced exactly that. They went in, they had their day, and on leaving the seminar and 2 to 3 weeks later, they've been able to come back and say that they haven't even thought about picking up a cigarette and they really are not thinking about smoking at all. So really positive news around that offer there. We've also seen that we've got 46 of our pharmacies now up and running to provide NRT supply for people that are accessing our Feel Good Suffolk service, and our Feel Good Suffolk advisors are supporting many people on their stop smoking journey. So really pleased to hear all that feedback. For our adult weight, we've been pleased to be able to enable people to access the information on our Feel Good Suffolk website at www.feelgoodsuffolk.co.uk, and also people accessing our Slimming World vouchers. We've recently had a gentleman that has come back to say to us that he's now lost 1.5 stone over the recent weeks, and really thanks the team for their support in enabling that to happen. So again, another positive news story for us. We're still waiting to provide our Feel Good Suffolk adult weight management offer. That will be starting on the 1st of April, where people will be able to access the Feel Good Suffolk advisor and the intervention offer that they will provide, and we'll be updating you on that as that comes on board. But there's lots of work happening behind the scenes to enable that. But in the meantime, people can still access the website and our Slimming World offer. So a huge thank you to the team so far for all their input, all the development work, the continuing review and updating of all the offers that we're providing today, and continuing to listen to the feedback that we're getting from those people that are accessing the service today. I know there's been some comments around the adult weight management offer, and just wanted to reassure everyone that we still got the Slimming World offer. We've got our website for both professionals and anyone else that would like to self-refer to be able to access information through that route. But also from the 1st of April, we will have our Feel Good Suffolk advisors delivering both face-to-face and online sessions to support people on their weight loss journey. Thank you to everyone that's been supporting us so far, and if there's anything else that we can help in terms of answering any questions or queries that you have about the service today, please let us know. Thank you. And as a way of a final goodbye, I'd just like to hand over to Laura Coolidge, who will take you through some of the operational work that's happening across the Feel Good Suffolk service. Thank you.
I'm Laura, a Health and Wellbeing Project Manager working on Feel Good Suffolk, and I'm going to be covering our operational updates for February. So starting off with some of our key updates, we're really excited to be welcoming our new Strategic Manager, Georgina Howe, who is starting with us on Monday the 26th of February. I'm sure you'll all get to meet Georgina very soon, and she's going to be working closely with you as Feel Good Suffolk continues to develop. In the last few weeks, we've mobilised 2 new smoking cessation offers, which is Swap to Stop, which is vape supply, and NRT and behaviour change. And I'll be providing more information around these in a few slides' time. But please do keep in mind that these offers are now available and being provided by our Feel Good Suffolk advisors. We have new promotional materials available for you to provide clients with upon referral. These cards provide further information about Feel Good Suffolk and our contact details in case the client would like any further information in the meantime. When you do refer clients to our services, please do give them one of these cards and inform that we're currently experiencing high demand for the service. So whilst we won't be able to provide an immediate response, we will be in contact with them as soon as we can with the next steps. And finally, we're working hard to become fully operational for April 2024. We really appreciate your support and patience while we continue to develop the service. I'm now going to give you a quick overview of our referral figures and some key data, which I hope you'll find useful. To date, we've received over 3,200 referrals across Suffolk, and these continue to be split evenly between the district and borough councils in accordance with their population sizes. As discussed in previous webinars, our reasons for referral remain high for adult weight management at 57.7% of all referrals. But we have seen a slight increase in smoking cessation referrals, with these now making up 28.5% of all referrals, and physical activity has seen a small increase too, now at 13.7%. Now looking at interventions, to date we've provided 1,156 interventions, which you can see broken down into the 2 tables on your screen. Slimming World vouchers continue to be the most common intervention. However, with the introduction of new interventions over the past couple of months, we will see the types of interventions becoming more varied. And of course, we'll be introducing new interventions over the next couple of months too. The figures for NRT and behaviour change and Swap to Stop will inevitably increase significantly over the coming months as we continue to roll this out to support more clients. From April 2024 and onwards, we'll see the commission services start to decrease in prevalence, and you'll see new options arise. So, for example, we're currently developing group support sessions for adult weight management. And I'll now move on to an overview of our interventions so you can understand what's currently in place, and for any interventions that are still in development, the timescales that you can expect those. For smoking cessation, there's been great progress over the last month. Alan Carr's Easy Way continues to be available, and clients can access his abstinence-based support via online webinars or face-to-face sessions taking place across Suffolk. To date, we've held sessions in Felixstowe, Lowestoft, Haverhill, Stowmarket and Sudbury, and we've seen really great feedback from those. 42 pharmacies have signed up to dispense NRT to Feel Good Suffolk clients, and our Feel Good Suffolk advisors are delivering one-to-one behavioural support to these clients. Pharmacies can continue to sign up to deliver this support through Farm Outcomes, and we'd really appreciate your support in promoting this. We're also working on an NRT postal service where NRT can be delivered direct to the client, and further updates and information about this will be provided in due course. Feel Good Suffolk has begun delivery of Swap to Stop in the last month, which provides free vape starter kits for 12 weeks to clients wishing to stop smoking tobacco. Alongside this, our Feel Good Suffolk advisors are able to provide clients with light touch behavioural support, and we're also working in conjunction with Suffolk County Council's Routine and Manual Worker Smoking Cessation Project, which seeks to target populations that are more likely to smoke and to provide them with support. We also continue discussions with Community Pharmacy Suffolk and the local medical committees across Suffolk to explore a primary care contract for GPs and pharmacies to deliver smoking cessation support, and we'll continue to keep you updated on this. And on a final note, we'd like to inform that Feel Good Suffolk does not currently facilitate a pathway for prescription-only medications such as Zyban or Champix, and we would encourage clients to speak with their GP to seek further support if they are looking for this. Moving on to adult weight management, the main source of support continues to be through Slimming Guard vouchers. However, as I mentioned a little bit earlier, we're currently developing our own weight management offer, which will provide further options for clients. These will be in the format of group support sessions, which will be available to attend either online or in person, and more information will follow in due course. It's also important to note that we're able to provide weight management clients with support through our physical activity pathways, and this also forms a valuable part of the adult weight management offer. Then finally, for physical activity, exercise on referral is available across all districts and boroughs. For exercise on referral, clients must be referred by a healthcare professional and meet the specific exercise on referral eligibility criteria to access. This is really important, and to ensure that clients are firstly safe to engage in that very intervention, but also so that our programme benefits those with the greatest need, and so it doesn't widen health inequalities. We also have a huge range of activities available through our leisure centres, and subsidised support is available for individuals who meet the eligibility criteria to access. Whilst we don't require healthcare professional referrals for our leisure centre activities, we would recommend that any clients with long-term health conditions visit their GP beforehand to ensure that they're safe to engage. Unfortunately, we're not able to provide targeted physical activity support to individuals with a BMI higher than 39.9. However, we will work with these clients to incorporate appropriate, accessible and safe physical activity into their lifestyles. Please also remember that our targeted offer is supported by a plethora of universally available activities, and then we coordinate a substantial wellbeing walks programme across the county, which is completely free to access. So that brings us to the end of our February webinar. In terms of final messages, please remember that we have our digital offer available, which provides information across all three thematic areas and enables individuals to help themselves. Some of your clients may find this beneficial, and it might be worth them trying out some of our tips and tricks before they're referred or they self-refer, so that they can be started on their health and wellbeing journey, and also so our targeted interventions are safeguarded for those who need that additional support most. We continue to keep our healthcare professionals webpage up to date with the latest news, and this is where you can find our eligibility criteria, so please do keep an eye on that. So thank you for listening to our February webinar. We hope you found it helpful, and we look forward to speaking with you again next month. If you have any questions or feedback, please continue to pass these on to us by emailing feelgoodsuffolk@suffolk.gov.uk, and we'll get back to you as soon as we can. Thank you for listening.
Hello everyone, welcome to the latest Feel Good Suffolk webinar for February. I'm Chris Pyburn, I'm Head of Health Improvement and Digital Health Services within Public Health, and I'm joined today by Bella. And Bella, can I ask you to introduce yourself, please?
Yeah, absolutely. It's lovely to be here, thank you. So yes, I'm Bella and I am the Head of Sport and Leisure over at Ipswich Borough Council.
Hi Bella, thanks for joining us. So few questions this month for you. I know Ipswich Borough Council is obviously a core partner with Feel Good Suffolk, so it'd be really interesting to get your perspective on it. But can I just start by asking for a bit about your role with Feel Good Suffolk, please?
Yeah, absolutely. So my role started just over 12 months ago with the programme, and was involved with a lot of the early design work that took place for Feel Good Suffolk. And so my role has really been that lead design officer that represents the views and the operating structures within IBC, so that we're able to help design a service that meets the needs of our residents, suits the needs of our residents, and also really draws in and leans on the strengths that my department especially has with our sport and leisure facilities, and our workforce and staff that have a lot of skills in the area that we're obviously looking to deliver against with the Feel Good Suffolk service.
So being that your role as Head of Sport and Leisure. Can you tell us a bit more about what in particular you're leading on? Which are the areas you're particularly involved with within Feel Good Suffolk?
Well, I don't think it would be too much of a surprise that out of the 3 thematic areas that are of a particular focus within Feel Good Suffolk, that I lead and sponsor the physical activity work stream in particular, which will involve the range of physical activity interventions that are available through Feel Good Suffolk, as well as bringing in our key partners, our wider key partners to Feel Good Suffolk that also have specialisms in sport and physical activity, so that we can really try and build a really well developed and defined system for how we look to increase physical activity levels across Suffolk.
And I guess something I'll be asking everyone who contributes to the webinar one way or another, but why is Feel Good Suffolk? It's a different model. It's something that I haven't done before. Why is it important to you? What is your sort of hopes and ambitions for Feel Good Suffolk?
Oh, I mean, that's a great question, and I think one of the primary outcomes, especially from my own perspective, is how we maximise our assets and our skills within districts and boroughs to be able to really reach into the hearts of communities and support people at the heart of everything that we do, but really support people with a longer term sustained attitude towards behaviour change. And something that really resonates well with me coming from a sport and physical activity background is really around how people being more physically active can really support someone in their resilience towards other well, potentially life issues or problems that people might be facing on a very individual level. And we know that being physically active and maintaining that as a habit, it lends itself incredibly well to being able to deal with challenges and sustain other behaviour changes as well. So we have that as an aspect in terms of supporting people quite directly, but we also know that being physically active has so many wide-ranging benefits on not only in terms of a health outcome, so reducing the risk of contracting or living with certain health conditions, but also in terms of someone's physical, emotional and mental well-being as well. And so by making physical activity in particular one of those core thematic areas, we know from the evidence that's available that we're going to have really good impacts at a very local level. And again, something slightly wider than obviously just looking at physical activity as from that perspective. Feel Good Suffolk as a whole, in terms of the intentions with the service and with the way in which we're delivering, we are really investing into our local workforces, which I think is it's a bit magical, I think, in a way, because we're really helping people to help people in a slightly different way. And I think that by investing in a workforce that is able to do that and embedding them within councils, it builds on an infrastructure that we're already well attuned to be able to deliver against. And it really maximises what impact we can have in an area that we haven't necessarily explored in this level of detail before. But we've proven time and again that we're able to deliver in these kinds of spaces. We're very good with operational services. We're very good with having residents at the heart of everything that we do. And this really just takes us to another level in terms of how we're supporting the people that live within our districts and boroughs.
Thanks, Bella. And final question, I guess, is what can we look forward to next? What's coming next in your area or in Feel Good Suffolk in general?
Yeah, so I'll speak from I suppose a couple of different perspectives, but in terms of some of the big developments that are coming up that I'm personally very excited about, will be our new adult weight management specific intervention, which will be delivered within the service by the staff that we're working with and that we're training to be in those roles. So by having that online, which is cross-cutting with physical activity, and embedded between the two is something that I'm personally very excited about.